Choosing ScanX Digital Radiography by Air Techniques was one of the best decisions I made for my practice. I wanted a system that would make transitioning from film to digital seamless. ScanX uses the same X-ray technique and patient positioning as film, so my team had absolutely no learning curve. The PSP sensors used with ScanX work with the same positioning device and X-ray system your office is currently using. ScanX PSP sensors are paper-thin, flexible, reusable, and best of all, wireless. My practice, like many of yours, treats patients of all ages with mouths of all sizes. ScanX PSP sensors come in sizes 0, 1, 2, 3, and 4, so they accommodate children, adults, and those with TMJ issues, large tori, gaggers, and geriatric patients. Before exposure, PSP sensors are placed into barrier envelopes, providing a protective barrier. My patients are protected by the disposable barrier envelopes that each PSP sensor is placed into. After the X-ray is taken, the sensor is removed from the envelope, placed into the transfer box, and the envelope is disposed of. ScanX has also reduced the amount of retakes needed. The entire PSP surface area is active, which means we capture 30% more of the anatomy than the comparable sized wired sensor. The comfort of the PSP also makes it easier for our patients to stay still during their X-rays. Have I mentioned that ScanX has been a big savings to my practice? We no longer need to spend money on film, chemistry, and all that labor cleaning the processor. Not to mention the disposal costs of the used chemistry and the waste space of the darkroom have all been eliminated. Unlike wired sensors that require insurance per sensor, ScanX PSP sensors require no annual insurance. In fact, if they need to be replaced, PSP sensors cost a fraction of the price of wired sensors. Besides fitting every mouth, ScanX fits every practice. If you need a system that will do it all, from intraoral to extraoral, ScanX Classic is the system for you. We use ScanX Classic because it covers all 8 imaging sizes. Not to mention, with 4 imaging slots working at the same time, ScanX Classic is a big time saver. But if you're looking for a chair-side system, then go for the more compact ScanX Swift. It accepts intraoral sizes 0, 1, and 2, and images are ready in 9 seconds or less. If you already own wired sensors, ScanX Swift would be the perfect addition to your practice. It could serve as a backup for your patients with smaller mouths or TMJ issues. ScanX worked with our current software through a Twain interface. Every ScanX system will incorporate into just about every software offering on the market via Twain drivers. Air Techniques has also been a great support by offering top-of-the-line customer service for installation and training. I can rest easy knowing my ScanX is backed by a company that has been in business for over 50 years.